Hi, my name is Dr. Rachel Vandenberg. I'm a naturopathic doctor practicing in Waterloo, Ontario, and I'm a member of the MammAlive Foundation, whose mission is to reduce the global risk and incidence of breast cancer through education. Breast cancer is currently the most common cancer in women worldwide, with at least 1.7 million women being diagnosed annually. We at the MammAlive Foundation want to reduce those numbers. One of the ways to do this is by teaching you how to do monthly self-breast exams. Today I'm going to talk about why we should do monthly breast exams, when to do them, how to do them, and what to look for. You know your body better than anyone else. Self-exams can be an empowering way to safeguard your health and become intimate with your own breasts. One American study shows that 43% of women discover their own breast cancer. 25% of these are through breast self-exam, and 18% are discovered accidentally, whereas 13% of breast cancers are detected through clinical medical exam by a medical doctor. When you practice monthly breast self-exams, if cancer is present, it will be found at an earlier stage and will likely be smaller and less invasive. With earlier treatment, you are more likely to live a longer, healthier life. In short, breast self-exams can help you find cancer at an earlier stage so that you may seek treatment earlier and live longer. Although screening tools such as ultrasound, mammography, and MRI are useful, in many places in the world they are unaffordable, unavailable, or women feel uncomfortable using them. Breast self-exams are a simple, low-tech way to monitor your health, accessible to every woman. If you notice anything unusual, you can then follow up with your doctor using other diagnostic methods. Because breast cancer is on the rise globally and can occur in any woman, doesn't it make sense for us to check our breasts? It's about you connecting with your own body, becoming familiar with your breasts, noticing any change or lumps so that you can find out what it is and get help if needed. Most lumps you do feel are likely to be benign and not cancer, so don't panic if you do find something. Check it out with your doctor and stay relaxed. Schedule breast self-exams into your monthly routine. Menstruating women should do them 3 to 6 days after the first day of their menstrual cycle. This is when estrogen and progesterone are at their lowest and the breasts are least tender or lumpy. Women who no longer have menstrual cycles can use the date of their birth. If your birthday is June 3rd, do them on the 3rd of every month. There are 2 components to breast self-exam, a visual component and a tactile component. Let's do this together. I'll lead you step by step through it. You can follow along with me, or you can click below to find written instructions. We'll start with the visual exam. First, take off your shirt and bra. Stand in front of a mirror so that you can look at your breasts. Observe their shape and size. Both of your breasts might not be symmetrical. It's normal for the breasts to be slightly unequal in size and shape. Notice the skin over the breast and whether there is any puckering or dimpling. Also, notice any discoloration, redness, or heat. Squeeze each of your nipples and check for any nipple discharge. This discharge, if present, could be milky, watery, yellowish, or bloody, and may indicate a hormonal imbalance, presence of breast milk, or something more serious. Other nipple abnormalities, such as sores, peeling, crusting, or any inversion of the nipples, where the nipple is pulled inward, can also be noted. Place your hands on your hips and apply pressure. Examine the contour of your breasts, noting any areas that are either pulled in or pushing out. Slowly stretch both arms over your head. Have a look at the breasts and the underarm area. Again, looking for any areas that are pulled in or protruding out. Clasp your hands together behind your head. Pull your elbows back and squeeze your hands together. Look for any changes in the appearance of the breast and the underarm area. Bend forward from your hips until your nipples point down, resting your hands on your knees. Observe the contour of your breasts for any irregularity. This completes the visual exam. Now we'll begin the tactile exam with palpation. It is important to examine the entire breast area. Breast tissue extends from 1 inch below the breast to the collarbone and from under the armpit to the middle of the chest. Begin by lying down on your back and stretching one arm above your head. If you have larger breasts, place a pillow at your side for support. The vertical strip pattern has been found to be the most accurate way to examine the breasts without missing any area. Place your left hand over the lower outer edge of your right breast. Using the pads of the 3 middle fingers, work in small circles. Use 3 levels of pressure to feel the tissue at various depths. First gentle, then moderate, then firmly until you feel your ribs. Check the underarm area for swollen lymph nodes. Are there any present? Are they hard or soft, painful or not painful? Keep in mind that 45% of all breast cancers occur in the upper outer quadrant of the breast, so spend a little more time in this area. Lumps can occur just beneath the skin or at the level of the muscle close to the rib. Larger breasts mean deeper palpation. Breathe slowly and remain relaxed during the exam. Note what you are feeling. Is the breast texture hard or soft? Is it smooth, granular like small seeds or sand, cystic, which feels like round fluid-filled sacs, fibrous, which feels long and stringy, or lumpy? Lumps may be any size or shape and may be soft or firm. Benign lumps are common and are usually due to hormonal fluctuations. They are likely to be smaller or disappear in the first 8 days of your menstrual cycle. If you are doing your exam in the latter half of your cycle, check again 4 or 5 days after your next period and see if the lump has changed or is still there. If you notice that your breasts are dense or have been told this by your medical doctor, visit our website at MammAlive.net to see our resource on how to decrease breast density, or contact one of our healthy breast practitioners. If you do feel something under one of the breasts, relax. When you examine the other breast, compare your finding to the opposite side. If it's on both sides, it's likely to be benign or normal. Also, be aware of any lumps or changes from your previous breast self-exams. If you feel something that is new or is just on one side, speak to your doctor about it. Now move to the area of the nipple. Feel not only the nipple, but underneath it as well for any lumps or pain. Lower your arm to your side and check for swollen lymph nodes above and below the collarbone. Now repeat the exam on the opposite breast. Finally, record your findings on a breast map diagram. This will allow you to compare what you notice from month to month. On your map, you can record the following: any lump, swelling, skin irritation, dimpling, pain, nipple inversion where the nipple turns in, redness of the nipple or breast skin, a scaly nipple or breast skin, or nipple discharge. You can download instructions and our breast map template from MammAlive.net. If you noticed anything of concern, take your breast map to your healthcare practitioner and discuss what you have found. Would you like to learn simple tips to help reduce your risk of breast cancer? We invite you to participate in our annual Healthy Breast Challenge every October. Each day, we will send you one tip. Continue the tips throughout the year to maintain a healthy breast lifestyle.